years ago, laws were put into place that required hospitals nationwide to post the prices of medical procedures so that patients knew how much they would have to pay for treatment in advance. But patient advocates say many hospitals still are not posting prices, and customers are being shocked by the large medical bills. Marisa Parra has more.
The pressure of paying for medical procedures has haunted Jeff King in Kansas for years.
I went back to my follow-up appointment. They said, "Oh, how you doing?" I said, "Well, your medical bill about put me into AFib again."
But it is his right to know how much a procedure costs in advance. And it has been since January of 2021, when federal price transparency became federal law.
It's so incredibly important.
Shakita Brooks-LaSure, the administrator for Centers for Medicare and Medicaid Services, also oversees hospital transparency. In a report released last week, CMS says that of the 600 hospitals they sampled, 70% were in full compliance, up from the 27% the year before. But patient advocacy groups are dissatisfied.
It is not happening fast enough.
And they're challenging CMS's survey results. PatientRightsAdvocate.org released their own report weeks ago, analyzing the websites of 2,000 hospitals within the nation's largest hospital systems. Their findings, only 25% were in full compliance. Patient advocate Cynthia Fisher shows us what patients should see on a compliant hospital's website.
It's showing all of the codes.
And she showed us what she found on many instead.
Instead of prices, they put NAs in the field.
So we took it to CMS.
Would this hospital be considered compliant?
Yes, because NA, according to our rules, means we don't do the procedure.
Which would mean if they provide these procedures,
They should be telling us how much it costs.
In the 2 years since the law took effect, CMS has only issued 2 fines, given as NBC was pressing the HHS secretary last summer.
The buck stops with you. You're the secretary.
Brooks-LaSure says they've given 500 warning letters to hospitals, and now the maximum fines have been increased from $100,000 to $2 million. So we asked, what's the biggest holdup? CMS blames the pandemic.
So they haven't always had all of the staff to really focus on some of the IT system changes that need to happen.
The American Hospital Association, which represents healthcare networks and hospitals, says health systems remain, quote, deeply committed, despite considerable strains on the hospital workforce over the past 3 years.
who hurts the most?
It's the American people. It's the hard
In
work.
Washington, Marisa Parra, NBC News.